Here's Dr. Esselstyn from the Cleveland Clinic. Here you see he used a very simple diet, didn't even talk to them about exercise and smoking. He just said, I want you to change to a very simple diet. You know what he prescribed? The 4 food groups. Do you know the 4 food groups? What do you think that is? No, he didn't prescribe the 4 food groups that we have today, namely McDonald's and Taco Bell and Burger King and something else. No, he prescribed, I want you to eat more foods that are grown in the Columbia Basin. What's that? Fruits and vegetables, and then add some whole grain products and some legumes like beans and peas and lentils. Food, real food, food as it comes out of the hand of the master designer. Natural foods, simply prepared. Are you with me? I tell people, eat more lentils. And they say to me, sir, what is a lentil? See, we have become used to getting our food from the grocery store that comes in plastic containers, in styrofoam cartons. All we have to do is put it into the microwave oven and we got it, right? It's not without danger, because these foods are usually very high in fat, in sugar, in salt, and they lack fiber, and they're usually high in cholesterol. Are you with me? And then when you don't exercise and you smoke on top of that, you can just see this creates the condition for a disease called atherosclerosis, which then expresses itself as heart disease, as senility in part, strokes, impotence, kidney disease, hearing loss, visual losses, and you name it. Here's Dr. Esselstyn. He takes these patients that could not have bypass surgery for various reasons. They came into his program and he said, I want you to shift towards a very simple dietary program. You're becoming part of a research project. These are people with heart disease. Over the next 5 years, none of these people had any heart disease evidence. No need for surgeries, no need for angioplasties, no need for medication. These people live normal lives because the arteries have begun to open up again, as you see here. This is a coronary artery. You see this white area here? This is a coronary artery. This is an angiogram. This is an X-ray of the coronary arteries. You can see there's not a sufficient blood flow through this portion of the artery here. This person suffers from inadequate oxygen because of the narrowing of the arteries, and that person has angina pain. 44-year-old surgeon. He comes to Dr. Esselstyn and he says, this is inoperable. I don't know what to do. I'm 44 years of age. Can you help me? He said, would you be willing to follow a very simple diet? Would you be willing to cut back on your cholesterol, on your fat, on your salt, on your sugar? Would you eat real food like fruits and vegetables? Are you with me? And whole grain products, and some beans and lentils and peas. After 2.5 years, the physician had his angiogram done again, an X-ray of the coronary arteries, and here you see the results. You see what happened to these narrowed arteries? They're wide open again. Blood can flow without any problems, and within months, this physician, this surgeon, no longer had angina pain, just by making some simple lifestyle changes. Dr. Esselstyn told me, he said, when my colleague had the second X-ray done some 2.5 years later, I was curious to know what happened to him. I know that the test was going to be performed, it was done, and that he would have the results. I came on the day of his results, and I went to his office and knocked. And when my colleague saw me, remember, he changed his lifestyle. He learned from Dr. Esselstyn and his wife. When he saw me looking through the open door, he got up from his desk. He closed the door, and then with tears of joy, he said, Dr. Esselstyn, You have saved my life. How can I ever be grateful to you? The results are here, and here are the results. Wide open arteries again. A changed man, no longer pain, but following some simple lifestyle change programs. And Dr. Esselstyn has written many, many scientific articles, and he said, what we need to do is we need to really help our patients to reduce their cholesterol in the diet, to have a low-fat diet, and then we can document with angiograms, with x-rays, that arteries begin to open up again, and the disease begins to stop, slow down, and regress. It opens up again. The arteries begin to get wide open again. He said, what we need to do, we need to go beyond just treating the symptoms. Medication can be helpful, but it doesn't stop the disease by and large. We have to attack the causes of these killer diseases. He said we need to educate people. We have to inspire people. We have to motivate people. We have to do it in a group setting so people can be taught as a group. We need to have restaurants in towns that serve healthy meals so that when you want to have a healthy meal, you don't have to feel like a health nut. And that's what we want to do here in Rockford, here in, yeah, you see, we have our national laboratory in Rockford, Illinois. We have 28 restaurants. We have 5,000 CHIP graduates that have gone through an education program, 40 hours of instruction. They know what needs to be done. They do it, and they have the results in weeks. And here we are very fortunate in the Tri-Cities where we have a hospital that is not only taking good care with high technology approaches, medically speaking, but they're also committed to working with people in this town here to provide education and inspiration and motivation so as to inspire you to do your part. Are you up to the challenge? That's the question. Oh, I talked to a man today, he said, I don't really care, I just want to have my cigars. I said, well, apparently you made your choice. He said, yeah. Well, if a cigar is that important to you, there's nothing I can do. But if you want to see your grandkids, just make some simple lifestyle changes. Have a normalization of your function. Begin to lose that weight. Do something for yourself. And of course, I'd like to recommend this book here called Prevent and Reverse Heart Disease by Dr. Esselstyn, an outstanding book. I think you would really appreciate this. It's one of my favorite books. And yet many people tell me that we had no idea that we can help ourselves. Take a look at diabetes. Here again, we have this tsunami of diabetes rolling over us, and yet we have in the medical journals people, this is going back to 1955, people on diabetes medication, on insulin, 80 patients. When they followed a very simple, more natural food diet, 50 out of 80 patients on insulin were off the insulin in weeks. The power of making some simple lifestyle changes. Here's Professor Anderson. He took 22 diabetic patients. They were taking 24 units of insulin a day. Within 3 weeks, they were on 0 insulin, and 5 years later, not one person was in need of any medication. That diabetes was totally taken care of. Are you with me? The power of what we can do for ourselves in the context of good medical care and support. The Pritikin program, which follows a very simple diet too, published many, many reports in the scientific medical journals that 85% of their patients with type 2 diabetes could stop their blood sugar medication, and 50% taking insulin injections were free of these shots within less than 4 weeks. What did they do? The magic is more fiber in the diet. Where do you find fiber? In fruits and vegetables and whole grains and in legumes. There's no fiber in animal products. There's no fiber in these processed, engineered foods. Sometimes the answers are too simple. And Dr. Anderson said 50% of the diabetics on insulin and 80% of those on pills could normalize their blood sugars and be off medication within weeks if they changed their diet. Here's Dr. Neil Barnard. He's written an outstanding book using a similar approach that Dr. Esselstyn used and we use. reversing diabetes. It's all there. Major scientific study documenting of what you can do to help yourself.